Jim, what exactly is irritable bowel syndrome?
Irritable bowel syndrome is common, and it's more likely in women than in men. The symptoms are bloating, gas, diarrhea, sometimes constipation, or a mixture of the two. However, it's very unpleasant, and as I said, it's really common.
Are there any other symptoms?
It's often associated with depression and brought on by anxiety or stress. It is not associated with bloody bowel movements or black bowel movements, and it's also not associated with abdominal discomfort brought on by diets which are high in gluten or lactose.
So how do you diagnose it?
There are no specific tests for it. Often we'll run some tests which rule out infection, anemia, blood in the bowel movements, things like that. And we also look for triggers that might cause it or bring it on.
Do you know it's not something worse, like Crohn's disease or ulcerative colitis?
If symptoms are persistent and include fever, weight loss, or bloody bowel movements, and in particular, if they're not relieved by the usual treatments, referral to a gastroenterologist is in order for a colonoscopy and other tests.
So, what causes it?
The cause for irritable bowel syndrome is not known. It seems to run in families. There may be a genetic connection to irritable bowel syndrome. We certainly know that stress brings it on, and in fact, it's well known that adverse life experiences are associated with irritable bowel syndrome. In fact, some studies show that up to 33 to 42% of women who suffer from irritable bowel syndrome have had a history of physical and sexual abuse. It's a mind-body connection. The nerves somehow become rewired, influence the digestive tract, and cause this chronic, persistent condition.
How is it treated?
There are many new medications to treat IBS. It depends on the symptoms, in particular, whether or not there's diarrhea or constipation. Certainly modifying the diet can be helpful, avoiding foods that contain gluten or lactose. And then there's this new concept of FODMAP diets, FODMAP diets.
Low FODMAP diets? What's that?
Now there's a complex subject. I recommend that you do an internet search for FODMAP, low FODMAP diet. It'll give you everything you need and lists of foods to avoid. And don't forget stress reduction. If you have a history for physical, emotional, or sexual abuse, it's important to connect with a mental health professional to discuss your issues and in a mindfulness sort of way to help treat yourself when it comes to IBS. And if you like this segment, like us on Facebook, and don't forget to subscribe to Be Healthy, Be Happy with Dr. Jim to power your path to happiness.